Remember that the word suture is used for ligation or to tie. So the use of suture is basically to make a knot. So the basic idea about the use of suture is to make a knot and to bring structures together. This is our number one. Now, when you talk about surgical sutures, definitely you are required to know very basic things only, not at all the details that we used to have before. Exams have gradually changed, in which remember that surgical sutures are divided into two types: natural and synthetic.
So can you please follow up once?
The natural ones are usually silk, made from silkworm. Catgut, not made from cats, but is made from the submucosa of sheep or cattle intestine. Synthetic sutures are example vicryl, example nylon, example proline, example PDS. So these are the things that are in your syllabus, and it is expected that as a student you are required to know these parts very well. Now, this is the first type of classification dependent upon the source. Please tell me when you have completed writing. Done. Dependent upon the physical quality of the suture. Now, remember that sutures can be divided as monofilament. Monofilament sutures are usually synthetic. Example is nylon. Example is proline. Example is PDS. And the advantage of this group is it allows a smooth passage through the tissue, whereas the disadvantage is it leads to a granuloma or foreign body. FB is not Facebook. Foreign body granuloma. When this polyfilament, remember, I should have said poor, not quality. Polyfilament sutures are also called braided sutures. Now, the example of this is catgut, silk, and vicryl suture, which is only synthetic polyfilament. These are natural. Now, what is important to know about it is that if these are the sutures and these are the ones, then these sutures, the advantage of this one is good knot. Why does it good knot? Because it has a poor memory. The word memory means the ability of a suture to retain the original state. If a suture was like this, when you try to open this, it will again become like this. This is called as a good memory. Whereas in this side, if you have opened a suture like this, it becomes like this, it stays like this. This is called as a bad memory or a poor memory. Okay, right. So this is a good knot that forms. The disadvantage of this is only one. It promotes a biofilm formation. The biofilm formation, it promotes a biofilm formation and promotes tissue infection. Promotes tissue infection. So this completes the list. Have you completed writing, sir?
Yes, sir.
Yes, sir. Good. Now let us talk about each of the sutures to start with. We'll talk about silk. Now the color of silk is black. The source of silk is natural, which means it is derived from the silkworm. Is exactly the same silk as the Banarasi sari is made. The physical quality is, this is polyfilament, and when you talk of the absorption time, this is in MBBS at least is a non-absorbable suture. It is not digested by the human body for some interesting reason, and the advantage of this is knots are secure. So the knots are secure. Please remember this. The use of silk is in ligating vascular pedicle. Example, cystic artery. Example, appendicular artery. Please tell me when you have completed writing. Done?
Yes, sir.
The second type of material is catgut. Catgut, remember the source of catgut, as I have said, is submucosa of sheep or cattle. It contains collagen and elastin. The original or undyed catgut, that means nothing has been applied, has an absorption time of only 7 days. 7 days means by 7 days, by 7 days, remember the catgut is digested. The T half means here not time, it is the tensile strength half is only 36 hours. That means by 96 hours, the tensile strength is taken away. So this is not a very good material. The only thing that you are required to know is that the only use of a plain catgut, also called undyed catgut, is in circumcision. Circumcision is one in which you are not going to remove the stitches. The color of a catgut suture is brown. We'll see pictures. When you have, sir, use is in circumcision, because in circumcision you are not going to take out the sutures. That is not a very intelligent idea. Now, dyed catgut is mixed with potassium dichromate. Catgut is mixed with potassium dichromate. The potassium dichromate and the catgut, both of them makes it the tensile strength is increased and the T half now becomes about 10 days. The absorption time is now 30 days on an average. So please remember that the tensile strength is 10 days, absorption time is 30 days. The color of a dyed catgut is deep brown. Lastly, use of a catgut suture, remember, or something called chromic catgut. Why is it called chromic? Because what is the material that we use? Dichromate salt of potassium. So use of a chromic catgut is in pedicle ligation, in hernia, okay, or peritoneal closure. Any form of peritoneal closure that you want to do, this suture, which is very good. This is the main point. This is a braided suture. Catgut, as I have said before, is a braided suture. I am going to show you pictures, don't worry. Catgut, as I have said before, is a braided suture. Please tell me when you have completed.
Done, sir.
Come to the arena of synthetic sutures. Now, when you talk about synthetic sutures, remember, the first one that we should all know is Vicryl, which is technically a company name which is not used. Hence, the chemical name of this is polyglactin 910. Now, 910 is a batch number. So, I will be very happy if you only remember one word, polyglactin. People will ask you, what is the chemical name in Vicryl? Is polyglactin suture. That's it. Now, this polyglactin sutures is a synthetic. The tensile strength half is maintained for at least about 30 days. Remember this, number one. Number two, the absorption time is 50 to 70 days. The mechanism of absorption is by hydrolysis. So remember that for catgut, it is by enzymatic degradation. Now, what is important in Vicryl is that Vicryl is a braided suture. Which is stained light violet. So the color of a Vicryl suture is light violet in color. You are going to see that. Though there is an undyed Vicryl also, you are not required to know that. The use of a Vicryl suture is enormous. From pedicle ligation, number one, subcutaneous stitch, number three, anastomosis in the GI tract, number fourth, muscle approximation. So this is a suture that we as surgeons use in majority of the cases. We know that. So this is all that is done. So this is called the vicryl suture. The vicryl suture, remember, is a absorbable suture. Is it synthetic? Yes, it is synthetic. It is absorbable. I'm bad with spellings. So this is absorbable suture. Use is important for exams. You are required to know what is a vicryl suture. The next of the sutures to talk about is nylon suture, which is non-absorbable. You are not able to digest nylon by the human body. What is important in this non-absorbable nylon suture story is only one. It is jet black in color, like the word that I am writing. It is monofilament. Number 3, it is shiny. So black, shiny, monofilament completes the list. The use of this one is abdominal wall closer, particularly number 1 suture, skin closer by 20, 30, 40 sutures, tendon repair by 40, and vascular repair by 50. But this is usually not preferred for a vascular repair. If you have not written this, no issues. This is non-absorbable, so there is no question about this to be used. Please tell me when you have completed writing.
Done, sir.
Good. The next in the suture, which is non-absorbable, is called as a proline suture. The name proline again is a trade name. The chemical name is polypropylene. The chemical name is polypropylene. Polypropylene. The suture is non-absorbable. The color of the suture is usually deep blue. Some people call this as a magenta color. The suture has a immense tensile strength. Remember that. Has an excellent memory, good memory. That means what is good in this suture is tensile strength is very good, memory is also good. This is good for abdominal wall closure. But the bad point is it makes bad knots. And hence, in a proline, we make 8 knots. We say 7 knots and 1 for the road. That means that's a way for those who drink, they know the meaning of 1 for the road. Now, so that means it is 8 knots. These ones, all the knots that you have seen before, silk, I give 3 knots. Catgut, 3 knots. Vicryl, 4 knots. 3 could be enough. but proline, 8 knots. Always. Use 1. Hernia surgery.
So nylon sutures also 3 knots.
Nylon suture 3 knots. I should have said that.
So catgut 3 knots.
Catgut 3 knots. Silk 3 knots. On an average, remember, we use 3 knots. 3 knots to tie a suture, except for Prolene, that takes 8 knots. Use is in hernia surgery. The next is an abdominal wall closer. This completes the list. Complete?
Dancer.
No.
The last of the suture in your list is PDS2, also called polydiaxonone suture. This is the company's name or the brand name. This is the chemical name or the chemical material is this. This is a monofilament suture. This is a delayed absorbable suture. Previously, we used to call Wickel to be delayed absorbable. We have changed our nomenclatures now. We don't call it as anymore. The absorption time is about 100 days, which is around 3 months or more. The tensile strength is maintained for about 60 days. The T half is a tensile strength of 60 days. The use of the color of this suture is again violet or deep again, so it looks like a Prolene suture. So the next one is the use of this suture is only in abdominal wall closer, and sometimes I personally use this for anastomosis. This is my suture of preference for all GI anastomosis. I really love this suture because it's so smooth in use. Remember this, it takes 3 knots, beautiful suture. The problem is it is very costly suture, but the use is in abdominal wall closer and anastomosis or GI tract anastomosis. Okay, so this one. Now, if you have completed writing, then I will come to a few pictures.
Dancer.
Right. Now, before I show you pictures, it is better to tell you, number one, the gauge of a suture. As I have said, you are not required to know the technical details. Remember that we use the US metric gauge, and we use sutures by the size of 0, 1 0, 2 0, 3 0, 4 0, 5 0, 6 0. What is happening in this? If the number of zeros increase, it is becoming narrow. It is more patla suture. That means if you consider human hair, it is 8 0. There are sutures, those of you in the meeting today, those of you who will be becoming microvascular surgeons, they will be operating on sutures that your eyes cannot see. That will be 10-0 sutures. You have to operate using those sutures. They are so fine sutures. You have to operate under a microscope. Whereas if you increase the size, this is 1, this is 2, this is 3, etc. So this is called as a US metric gauge. Any suture has an adequate length, and the length is expressed in centimeters, 100 centimeters of suture. So this is all about the sutures. Let us have a quick look at the sutures, and then we talk about with the needle. Now, before I talk about the sutures, there is a color code that I wanted you to take a snapshot for. Okay. Now, PDS is not gray exactly. PDS, this is wrong. So I will Sorry. I will erase this point. PDS is not gray, so please don't mention this one. Right. The rest of the things again. Okay, so I will no. So these are a few things. Please ignore the picture, sir. I shouldn't have shown the picture. Very sorry. Ignore the picture. See this one. Now, this is a suture which is a PDS2. I think, can you see the right of the picture is not so prominent? Hello?
Yes, sir.
Yes, sir. Okay. Kindly see the color of the suture. The color of the suture is violet. It is written over PDS2, so you can understand it is written monofilament. I know the picture is not that great. That's it. What is the gauge of the suture? 0. So please remember, manufacturers will come up with these things written on the pack. So it is up to you to interpret what is the use. Like this is a suture, that is something that I use for an abdominal wall closer. I use this suture in an abdominal wall closer. This completes the list, sir. Okay. Now talk about the next suture. This is a picture of something called as a nylon suture. See the color. A nylon suture, as I have said, is black in color. This is monofilament, shiny. You cannot see, you can see only one filament in this. So this is monofilament. That means if I take a cross section of this, you are going to see only one filament, monofilament. So this is technically called as a nylon suture. Okay. Now, can you tell me what is this suture by the color of the suture?
Undyed
catgut. Very good. That's a very impressive answer, sir. This is technically a catgut suture. Those of you who have said an undyed one, I should give you a chocolate. This is technically plain catgut. How to make plain to chromic? Simple. You add potassium dichromate. Very nice. So the color then becomes deep brown. This is only interesting is that catgut is the only suture that the manufacturers give us which is stored in alcohol. So the packet that you will see, the packet contains a little bit of isopropyl alcohol. Because as this is a protein, if you keep it in air, it may get denatured. So they feel that it is good to give it in alcohol, and the preservative of this is alcohol. Okay. Now to the next suture. Yes, this is the one that I really love. In this picture, can you identify the color, sir? Is this a monofilament or a polyfilament? What is your opinion?
Polyfilament.
Very good. This is a polyfilament suture, or technically called as a braided suture. What is the color of the suture?
Light violet.
Violet. So what is this suture? Can only be one. Vicryl can be vicryl suture. So this is technically a vicryl suture, which I do not know the size, but size is not important because in a real world you will get to see the packet. Okay. Now come to suture. See. This is a proline suture. You can see everything is written on the pack. Color is blue, monofilament. You can see the color, blue monofilament. This is a number 0 size. Everything is written. Okay. The length that they have given is 75 centimeter. 30 inches is also seen. The picture quality is not that great, but still you can see that. So this is technically called as a proline suture. That means if you are given the suture only, well, depending upon the color and whether it is monofilament, this is something that I really feel difficult to be taught in a virtual class because I need you to feel the sutures. What is the color of the suture? Black. And this suture is a braided suture. So the black monofilament suture is nylon. The black braided suture, you have understood with the term braided. Now braided cannot be understood by looking at the picture only. It has to be felt by your hands, which is not possible in a virtual class. So this one is a braided black colored suture, is thus a silk suture. The last one, again, we have Vikrill. Remember that until and unless I take a very close shot, you cannot appreciate the braided nature. But you can understand few things that are written on the packet. So I think you can understand things that are written on the packet now. Can you see that it is written? What is the material? What is the chemical in a Vikrill?
Polygalactic.
What is the color? Violet. What is the nature of the suture? Braided. What is the size of the suture?
20.
So, what is the length of the suture?
70 centimeter.
Very good. So, guys, this completes the list. We go to the next topic of something on needles. Now, we didn't talk about needles in this. When you talk about needles, or technically enough surgical needles, remember that a straight needle looks somewhat like this. This part is called as the eye of the needle. This is the body of the needle, and this is the tip of the needle. Now, this type of needles are used for skin suturing. You must have seen some senior gynecologists use them for skin suturing because they feel if you talk to tailors or maybe you can ask Ma in your house today that show me that sewing kit, सिलाई करने का सामान दिखाइए. So probably the needle that comes out of the stitching box, I think, is this one. So this is this needle. That is something that you have seen. Okay, right. Now, what happens is that we surgeons feel that it is cumbersome, and what we have done is that we have made this same needle. We have bent in the needle, and this one is again called as the eye of the needle. This one is the curvature of the needle. So the curvature of the needle can be half. The curvature of the needle can be 3/4. Curvature of the needle can be like a J. So there are many curvatures that you are not required to know because curvatures determine the use that you are going to be. But what is something that I am interested to know is the length, L. So the L is say 30 millimeter. That means the gap between the apex to the eye is 30 millimeter. So the logic is very simple. The lesser is the size, the smaller is the needle. So small and large needles, all that matters is this point called as L. Now finally come to two ends of the needle before we come to the tip. The ends of a needle can have two kinds of arrangements. Look into that. One, you can have an eye, and through the eye, you have to introduce a suture. This type of arrangement is called as a needle with an eye, and these are used for skin suturing only, which is somewhat traumatic because, as you can understand, the eye is a big bulky part. It has to go through the tissue. That's a very difficult one. Whereas on the other hand, what we have done is that, or manufacturers have done is that, and those of you who are not good in making needles or having the sutures in the needles, what is very important is that what the manufacturers have done is they have joined the end of the needle, with the suture. Can you see the technology? So the technology definitely, which one will be more costly? You can understand that. The second one. So this kind of sutures in which the needle and the suture are joined together, this technique is called as swaging. SWAGING. Swaging of suture. And when you talk about a swaging of a suture, remember these sutures were invented by an engineer called as Marr, and they are called as Mur suture. So this is history, not required to know. For us, they are called as achromatic suture. For us, they are called as an achromatic suture. For us, they are called as an achromatic suture. Okay. Finally, come to the apex of the needle. Apex of the needles are of three types, at least for you guys to know. If you think of the first kind of apex, look into the first kind. Please look into that. It gradually tapers into a cylinder. A cylinder tapers like a cone, an ice cream cone like thing. This is called as a round body. Round body needle. Whereas, understand that what happens is, if the suture, the needle end will be in such a way that the end looks like this. Understand the shape. Sorry, I should have drawn a. The needle looks like this. The tip looks like this. This kind of tip is called as a cutting needle. In a cutting needle, I hope you will understand that the apex of the triangle is up. That means apex of the triangle is towards the concavity. Whereas think of another needle in which think of this as the shape, or think of this as the shape. So in which side is the triangle pointing?
Reverse.
Reverse. So this is called as a reverse cutting. Now both of them are used for tough structures. Usually we use this for the skin. Usually we use this for tendons and fascia. Okay. So these are the three types of needles: round body, tough structure while cutting. That means the apex of the triangle is towards the concavity, and if it is a reverse part, that is a reverse cutting needle. So this is all things that you are required to know. If you have understood that, then tell me, as I've said, this is very difficult to see on a 2-dimension without feeling this. Okay, can you tell me what is the tip of this needle? It looks like the triangle and looks like this. Can you tell me what is this needle, sir?
Cutting needle.
Cutting or reverse cutting?
Reverse.
See, when the apex of the triangle, the apex of the triangle is for, this is a reverse cut.
Cutting.
No, think. A cutting will look like this. A reverse cutting will look like this. In this picture, where is the apex of the triangle getting pointed to? So difficult, I know that. It is very difficult to understand it on a 2-dimension until and unless you fall. Now see this one. Again, what do you think is this one, sir?
Reverse
Okay. So this one is reverse cutting. Very good. You understood it. Chalo, theek hai. Now, how do the manufacturers have maintained that? Let me take this one. This is easy. The manufacturers, what they have done is that they have maintained that this is a taper cut. That means it is again a cutting, or better called as a taper cut. Please see the curvature of the needle. The curvature of the needle is half circle. What do you mean by 36? Is 36. Okay. So the tip of the needle is what is told by the manufacturer by a taper cut, which means a cutting. Okay. Now I will go back to this one. Okay. So this is this part, not very well shown. Let me take another picture if I have. Sir, very difficult to make you understand in a 2 dimension. It is strongly recommended go to your college. The next time you go to your class or go to your college, go to the theater, ask for a cutting needle, ask for a reverse cutting, and ask for a round body needle. At least see once in your life, keep it, have a feel of this once. I think things will be clear. Because in a 2 dimension, this is the maximum that I can make you understand. Okay? Or maybe let me see if I can arrange. No, I do not think I will be. Because these are again haptic feelings. You have to feel it by your hand. That is something, sir, that I cannot do on a virtual one. So please look into them in your class and then I. So this is all about sutures and needles. I told you I will be telling you something on proline mesh, which I feel some hospitals have given this year in exam. I do not feel it should be given to an undergraduate, but still they have. Remember that the proline mesh is used in a hernia surgery. What type of hernia surgery? Inguinal hernia surgery, incisional hernia, umbilical hernia, more than 2 centimeter, incisional more than 2 centimeter. This is used routinely. The mechanism through which a mesh is acting is that what a mesh does is that a mesh encourages fibrosis to happen because there is fibrous tissue which grows. Fibrosis in between the pores of mesh. This is what is the mechanism. Finally, the fixation of the mesh is on the margins, or better answer is near the margins. Last one but not the least, what is the size? As I have said before, if this is the size of a hernia X, the size of a mesh is in such a way that you have to maintain a distance of 5 centimeter on all the sides with the mesh in center. So always remember that keep the mesh in center and then always have a 5 centimeter excess site, or not site technically. So it is 5 centimeter excess margin. That's it. Complications of a mesh are 2. 1. Infection, sinus formation, which is a very damn problem. Abscess formation. Number 2. Mesh granuloma, also called a meshoma. You'll be laughing now. Not meshomocyte. It is called as a meshoma. So this is all things that an undergraduate should know. You are not required to know non-absorbable meshes, heavy meshes, lightweight meshes. These are not at all MBBS topics. They are postgraduate topics that are required for laparoscopy or advanced hernia surgery. So this is all that you should know about a mesh. Use, mechanism, fixation, size, and complications. So this completes all your needles and sutures wala story. So we'll take around not too long time on finishing the last topic of practicals. There is something on problem card discussions. Any queries before I go to the problem card discussion, sir? Hello?
Yes, sir.
No problem. Chalo. Now when you have the last table for 5 marks, please understand that a problem card discussion is not a long question discussion in front of the examiner. Unlike books which are maintained pages and pages, and students get confused, I am not going to do that. I am not going to give you pages and pages of notes on problem card. I am going to do the easiest topic. I am going to say exactly the points that you are going to say in a problem card in an exam. Nothing more. You remember, this is 5 marks. Examiner does not want anything excess from you. The problem cards are divided into non-trauma. Remember, this is not a theory long question bolo. This is a mistake that students do. Examiner has very focused questions. We will be discussing the questions only because the theory has been taught. In non-trauma, the first question is, I will think it is more of an interaction. What are the causes of pain in right iliac fossa? You may be given a question, clinical question, like a 20-year-old lady came with a pain in the right lower abdomen. What are the causes and what are the differential diagnosis? Remember, the answer that the examiner wants to hear are, if it is a male, if it is a female, then what are the causes? In female, remember acute appendicitis, followed by ectopic pregnancy, followed by twisted TO mass or ovarian cyst. In a male, acute appendicitis, then cystitis, ureteric stone. That's all that you need to say to the examiner to pass. Kuch nahi chahiye. At this point, the examiner can ask you, how do you diagnose appendicitis? Please refer to your theory chapter of appendicitis. You are required to know what is Murphy's triad. I will not be telling you for one single reason. If I tell you, you will not be reading the theory again. Murphy's triad is accumulation of pain followed by nausea, vomiting, followed by the shifting of the pain to the right iliac fossa, followed by fever and tachycardia. It is called as a triad. It is not a triad, it is a quadrant. Lastly, you will be asked a score called as Alvarado. Very focused question, focused answer. Please don't say this is a long question on appendicitis. It is not. This is not telling the examiner 29 causes of pain in right iliac fossa. No, this is not. Examiner wants to hear acute appendicitis, common causes, guys. That's it. He does not want to hear bigger things. This is 5 marks short table. Come to the next non-trauma.
Toyota ki?
Sir, tube ovarian mass.
Okay.
Come to the next of the non-trauma scenarios is pain in right upper abdomen. Now, pain in right upper abdomen, the examiner is expecting you to talk about acute cholecystitis. In this one, the examiner is expecting you to talk about other causes of pain in right upper abdomen, which includes acute cholecystitis, number 1, number 2, liver abscess, number 3, maybe acute duodenal ulcer pain. Less common will be a duodenal ulcer perforation, which will be associated with a pain not in upper abdomen but mostly in epigastrium, and then it radiates to the